Hey there, and welcome to Sip of Wellness, the podcast where we dive headfirst into the awesome world of healthcare and wellness. Stick around as we chat about all sorts of things, one sip at a time, uncovering the essential details that shape how we feel physically, mentally, and emotionally. We're diving into awesome interviews with experts, engaging discussions that make you think, and the facts that are here to support you all the way. So grab your go to drink, find a comfy place, and let's gulp into some wisdom to boost our journey to a balanced and great life. In today's episode, we're having a very special guest, Dr. Walid Obeid, who is a urologist. Welcome, Dr. Obeid.
Hi, thank
How are
you.
you doing?
Good, great.
How is your experience, Hala, in first podcast?
It's very nice. Thank you for accommodating me today, and I'm looking forward to have a nice episode with you.
Same here. We're looking forward to have a great episode and dive into all the wisdom that you will share with us today in the field of urology. Our topic today is going to be general health in men, to talk everything that is related to men health in every aspect. But before we start talking about our topic, would you just like give us a little background about your experience and how was your journey starting in medicine and then specializing in urology?
Yes, actually, I started medicine in 2004. I finished my training as a general doctor in 2011. Then I specialized in urology, and I finished my training in Beirut, in Balamand University, in 2017. Then I did 2 years of training in Belgium, in Brussels, and I was back to practice in Beirut in St. George Hospital. It's a university medical center. I finished and I worked for like 3 years. And then I got the opportunity to come and practice here in Dubai, and it's been around a bit more than 2 years here.
So you have been into three different areas with three different cultures. How was
Yes.
the experience? I'm sure it was very rich.
Yes, definitely. The experience is very rich. Every country has many things to offer, and you meet like a lot of different people with different mentality. But as you know, Dubai is one of the most welcoming countries and very diversified. So its own experience is definitely unique.
That's true. That's definitely true. The diversity that is here, I believe, like we cannot find it anywhere else.
I
And
definitely agree.
the acceptance of culture also gives a person a huge different experience as well. So, getting back to our topic, men's health, as we were discussing before the show, we were saying that women's health is always given more importance and it's more discussed, but men's health is not. Why is it so?
Yeah, actually, men tend to more like to hide things and to keep things for themselves, especially whenever it's something medical, unless they feel like they have something which is very important to signal to the doctor. They try to avoid and say, "Okay, I'm just gonna be fine. I'm not gonna die. I'm just gonna be okay.
I'm going to man up.
I'm gonna man up about it." Yeah, which is actually, in this case, it's a wrong attitude. So I don't like when people are worried too much, but sometimes we need to like share what's happening to find proper solution. And sometimes the solution is easy and it can really have a great impact on one's life.
Doctor, do you think that the reason why men have this attitude is because of the cultural way of growing up from childhood? They always tell them that men are not supposed to be expressing how they feel.
Yes, actually, I can say that you're probably very right about it. Men try to hide sometimes even feelings, so medical issue because sometimes it touches, especially in urology, it touches sometimes their manhood. So it's more difficult to open up about the subject and to speak about it, and they feel like shame and worry about specific issues.
So speaking on this, this also is the reason why it leads to high rate of depression in men as well, right?
Yes, definitely, it's
It all is related
correlated. Yes,
to it
definitely,
all. So
definitely.
what do you think can be done to avoid this or to change the stigma about men's health in general?
Yes, definitely. I guess The role should start by doctors, because doctors should make like more informed, should be more informative and more like close to the people whenever you see someone. So they should be more accessible and probably maybe friendly and easier to discuss with. And whenever we doctors say that these things can be like treated and can be managed, so patients are more willing to talk about it. And whenever they know that these are common issues, they are definitely more willing to talk and discuss about it.
That's true.
So as doctor, we should do like more awareness and make it easier for the people who suffer in silence to speak about their issues, to help them and for them to get a better quality of life eventually.
Definitely, definitely. Speaking of urology into medical conditions, one of the most common medical condition that is diagnosed in urology is urinary tract infections. Can you
100%.
just dive into this more?
Yeah, actually, urine infection is, as you said, is one of the most common issues faced. But to note here that women suffers more than men from urine infection. It's just because of our anatomy. Okay, as we know, female have what we call a very short urethra. So from the opening to the inside of the bladder, this passage is called urethra. In women, it's very tiny. In men, it's longer because they have the genitals, the penis. So they are more prone to infections. And infection happen due to a lot of factors that we're gonna dig in and discuss. But it's one of the most common complaints we find in clinic, and people usually come with what we call dysuria, which is burning urination, urinary frequencies. They tend to pee more often, and in specific cases, they can even leak urine because of the infection. It happens more in women because of the man having a longer tract. But yeah, that's it. And it can be sometimes worrisome for patients because they can also see blood. So whenever people see blood, it's like, oh my God, it's a red flag. Right? Also, blood, whenever it's a urine infection, it means that just it's a strong infection. It does not mean anything else.
The symptoms for urinary infections can vary. For example, there is infections that would happen from the kidney, starting bladder as well. The symptoms are the same, or we can say it's different?
It's a very smart question. Actually, whenever we say urinary tract infection, for female it can be mainly bladder and kidneys, and for male it can be bladder, prostate, and kidneys. So the main difference is whenever we have an infection in the kidney, usually it comes with fever and pain. Whenever we have an infection which is localized to the bladder, it just comes with symptoms of increased frequency of urination, of burning, and discomfort. And the treatment is just the duration of antibiotics. While we treat like simple urine infection in women with 3 to 5 days of antibiotic only, whenever it's a kidney infection, we need to treat about 7 to 10 days of treatment.
And when it comes to antibiotic, now over here, if one patient hears, oh, I have UTI, the other one would say, yes, I have, and the doctor prescribed me this antibiotic. Go ahead. Do we recommend that? This question
Of
is
course, as a
very
doctor, I should not recommend that. Yeah,
definitely, yeah.
because usually what happens as probably we are suffering more and more resistance. So resistance means that due to using more and more of antibiotics without actually doctor prescription, people become resistant to certain antibiotics which typically should respond and should like treat infection. So I usually, whatever I do in my own practice, so I know because people who have UTI are really bothered, so sometimes they cannot wait. So what I tend to do, I tend to tell the patient, okay, we'll collect a urine sample, we'll start by antibiotic treatment, and once we have the final, what we call culture result, which
Yes.
takes usually 48 hours, we can discuss, and sometimes we will have to change the antibiotics. The only difference it makes that we will know which germ we are treating, and it will make the treatment like more tailored to the patient need.
And this is mostly also used for recurrent infections as well. We have to repeat the culture to.
Yes, exactly. In recurrent infection, definitely we should always do like the urine culture to check which antibiotics, especially because some old antibiotics that we took like a few months ago would not respond most of the time. But whenever we have recurrent infection, we should try to find the reason, not just treat. Because if we if we just treat it, it's gonna remain recurrent and annoying to the patient.
True. Speaking of reasons, there are various reasons, and could you just more explain us more who are those who are more prone to having infections?
Yes, definitely. Now, as a general rule, people who do not drink water are more prone to have infection. People who tend to hold their urine much during the day, maybe due to work, maybe in male due to prostate issues, they tend to not empty their bladder well, as we say. But people do not realize it. So people usually tend to say, yeah, I empty my bladder well. And whenever we do an ultrasound, which shows that after they void, we do what we call post-void residue. We see that urine remains in the bladder, and this is one of the main reasons for infection. And definitely, as we said, like not drinking water, constipation can be also a risk factor for infection. And now sometimes this we cannot like control it, but some people have what we call like anatomical defects or in the bladder or in their urinary system, which makes them automatically more prone to infection. That's why whenever patients have recurrent infection, we need to investigate a bit more and try to understand if we have any underlying major issue which needs to be tackled.
What about kidney stones? That could also be one reason why
Uh,
infections occur, right?
Actually, yes, definitely. There is one type of kidney stone which typically causes a specific type of infection. So usually we need, whenever we have recurrent infection, we need to check the kidneys to check if they have any stones, because some type of stone shed specific bacteria and it causes like recurrent infection.
Can you talk about the different types of kidney stones that one can actually have?
Yes, sure. So mainly we have like a lot of type of stone, but like the main are what we call usually calcium oxalate. It's like the most common. It's like around 80% of the stone. We have what we call uric acid stone, which are usually from increase of red meat and stuff similar to that. And also we have what we call struvite stone, which are common, and we have some stones which are hereditary. But usually all stone have in common like lack of drinking water is one of the most common factor for all the stone. So usually it depends on the type of stone. We have different type of treatment, because some stones what we call are radio opaque, so we can see them whenever we do an x-ray. So sometimes we can tackle by using like what we call ESWL, which is external shock wave lithotripsy, and try to hit the stone from the outside and make it a small fragment for it to pass alone. While some stone as uric acid are usually not shown on x-ray, and they need like treatment whenever they are small. They just need treatment with what we call urine alkalinizers, and if they do not respond or they are really big in size, we go to surgery.
Surgery, mostly, is it open surgery, laparoscopic? This is what patients would be more interested to know.
Yes, of course. So usually surgery for stones, nowadays we never like open the patient to remove any stone. So usually it's called endoscopic surgery. So we go with a very tiny materials. We go inside the ureter. We can even reach the kidney, and we tackle the stone directly. So usually what we do is we use laser fragmentation, which is a very thin material. It's like hair. We go inside the ureter, we try to fragment it, it becomes into pieces, and sometimes we use a basket to be able to remove and retrieve like the small fragments.
Every size of the stone has a different way of treatment.
Yes, exactly.
That is how it is.
Exactly. So usually as a general rule, stones that are less than 5 millimeter, we say they have a very high chance not to cause any issue and to go away alone, with maybe some medical supplement to help them pass tight ureter. But most of the stones which are like larger in size, usually we need to tackle them. And we need like one thing we need to know, that whenever the stone is in the kidney, no matter the size, usually it does not cause any pain. And the pain is caused whenever this stone comes into the ureter, and then whenever it's in the passage, it becomes tight and it blocks urine from flowing. That's why it causes like dilation in the kidney and pain and discomfort in the patient.
And one of the common complaints that patients used to tell me was that it's more like a labor pain. So it's kind of funny when men actually say that the pain is like a labor pain. Can we say that it is? I don't know.
Look, I did not experience labor pain.
Definitely.
Yeah, but I can say that it's a very severe pain. And what's annoying about it is that people tend to be like really restless, and sometimes they can like just feel okay for like half an hour, and they say, okay, I'm done, and then it comes back again. And this is because the stone can move inside the ureter. Sometimes it can block more if it's tighter part, and sometimes whenever it's a bit wider, urine will flow a bit and the pain will go away suddenly.
When we talk this is about kidney stones, is like it comes out and then when it's in the ureter, that's when pain happens.
Yeah.
What about bladder stones? They tend to be larger and they have no symptoms, and it's most of the
Exactly.
time found coincidentally. How is that managed?
Yeah, so usually bladder stones are a completely different entity. So bladder stones are usually due to an obstruction, usually in male, due to the prostate. So whenever people tend to not empty their bladder well, this residual urine can form like sediment, and this sediment can eventually form into stones, and these stones can be really like large stone. And one of the reasons also is like sometimes people have what we call atonic bladder, which is a bladder which does not contract. So whenever the bladder does not contract, it means in a directly like incomplete bladder emptying, and it can form the stone. And the stone usually is huge in size. It can reach up to like maybe 10 centimeter even. It can be like really huge in size. So whenever we have this issue, it's like completely different. We need to understand the mechanism of if it's like due to obstruction, which is something which is tight, or if it's due to what we call an acontractile bladder, atonic bladder.
When we say atonic bladder, can we say that this is an old people's problem, or it can happen at any age?
Yeah, actually, it can get to anyone. So some young people have problem with their spine, because the spine is the main like organ which affect the bladder, and due to sensory nerves and everything. So no, it can reach like both young and old people.
But they say gradually, as you grow old, it's the normal way of life. Bladder issues come up with it. Is it really common that old people have bladder issues?
Yes, actually, this is common. So old people tend to have more bladder issues. Usually males, because of the prostate which is obstructing, it will later on cause what we call like a bladder hyperactivity, and they will tend to pee also more often. And for female with age, also the bladder like contractile tissue will change a little bit, and it might affect it.
Talking about prostate now, one of the most common condition with the prostate is BPH, benign
Exactly.
prostate hyperplasia. Could you just explain more about it?
Yes, actually, just for the people to understand, so prostate is a gland which is directly below the bladder. All right, and this gland is usually helps with having like better like semen quality, and it has like some secretions which helps the semen be like safe and in a good environment. But this prostate usually it grows with age in every man. All right, so whenever it grows, it causes usually symptoms because the passage becomes more narrow with time, and whenever it becomes more narrow with time, so people male tend to have like what we call LOTS symptoms, which are lower urinary tract symptoms, which means that they push more to pee, they tend to pee more often, they wake up at night to pee, and they suffer sometimes from even burning urination due to that.
As they age, men, the percentage of the prostate increasing in size is there. It's normal. But when can we say that it's really
An issue.
hyperplasia an issue? Yes.
All right. So usually what we say, the size does not really matter of the prostate. So some people have like smaller prostate but have more symptoms. So as an objective assessment, we have like two main things. One of them is we do an ultrasound to check on ultrasound if the bladder is emptying well. If I have like a very large prostate but the person is emptying his bladder well and does not suffer any symptoms, I don't have to treat it. But while maybe sometimes I have like a smaller prostate, which is not really enlarged, and the person is not being able to empty well and is suffering and being frequently and waking up at night. And this is here when once we need to give like a treatment for it. So it all depends. So usually the prostate size is normal size is from 5 till around 20, and it can grow up to 200 even in some men.
And it can be problematic eventually.
Yes, definitely.
Yes.
Whenever it becomes bigger, it tends to be more problematic. But we need to objectively assess to know if we need to treat or not.
And the management would be more medication, or could it eventually lead to a surgical procedure as well?
As a doctor, usually we should never. I suggest that we should never start by surgery. So first line always is to like tackle it in with medication. Medication usually helps both to decrease the size of prostate and to like open it up a little bit to make it like easier for the person to pee. And whenever we have like cases which are refractory to medical treatment, definitely we are here to help with surgery. So there are a lot of surgeries possible to be able to relieve the obstruction. And the surgery usually depends on the patient and on the age and on all these factors.
The surgery is definitely mostly transurethral. Would
Yes.
the surgical procedure have effect on the male's fertility aspect, since prostate is a reproductive organ as well?
Yes, it's a very common and good question. Prostate surgery, usually it depends on which type of surgery we do. Some surgery are called like less invasive and like a new technology which affect less what we call the ejaculation, because for man ejaculation is very important and it will affect eventually his fertility. So some treatment are less invasive and they do not affect ejaculation. Some other treatment which are conventional, which are sometimes more potent, but they affect ejaculation because the ducts of ejaculation are very close to the area of the prostate. So whenever we do the surgery, it's very hard to see them in naked eye. Even with the microscope, we cannot see exactly the ejaculatory ducts. But there is a big misconception that prostate surgery usually does not cause any erectile dysfunction. Routine prostate surgery do not affect erectile function. Actually, the one which affect erectile function is surgery for cancer, because whenever we have a cancer, usually we need to remove the gland as a whole. And whenever we remove the gland as a whole, we tend to before at least we used to like touch the nerve, which are nerves that helps to have a proper erection. So whenever we touch them, it will affect the male potency. But otherwise, the routine surgery will never affect the male potency.
Talking about cancer, how common is prostate cancer? Right now we have even November, the month of awareness. Do you think that has helped in diagnosing prostate cancers earlier, or it's still in need of raising awareness?
Yes, prostate cancer is actually a really interesting issue because men are really worried about prostate cancer. Now, what we need as a urologist to inform people. So, prostate cancer is really like is kind of the most common cancer in men, but that does not mean at all that it's gonna kill you or gonna affect your life. So usually we need to have proper like testing to check, and we're gonna speak about them. And usually screening start at 50 years of age. It's start with a simple like a blood test, which is called PSA. And addition to the blood test, we have what we call the rectal exam, which is the dreaded exam of the people. But usually the doctor have to do it to check that the prostate is soft and it does not have any nodules or anything. So usually once we do these diagnostic tests must be done like once every year. Prostate cancer is a cancer which is good about it. It's that usually it's really slow, and even if it affects people, it can be really like cured completely if it's caught in time. It's very rare to have a prostate cancer which is really aggressive and kills a person unless it's really like diagnosed at a very late stage. So that's why we suggest like routine screening, which can be helpful, very helpful actually, to control the cancer and have like a very normal life afterwards.
Is the routine screening for someone with a family history of prostate cancer the same as someone with no family history?
Yes, actually, we recommendation are we screen men starting from 50 of age, unless they have a family history. Now, family history, if one has a family history of like a father who has a prostate cancer at 70, that would not change the testing at 50. But whenever we have early prostate cancer in a man, so we suggest that we start like around 5 years earlier. So if he had it like at 55, we start at 45 because usually 50 is the threshold. So 5 years earlier than the threshold.
And how often do they need to do these tests? Yearly or every few years?
As women go to their gynecologist usually yearly, we suggest that we see men yearly because it's by the guidelines, and the guidelines are made to make life like easier and to help people who have like any kind of disease. So we know that if we screen and detect prostate cancer, it can almost definitely be cured if it's detected in early stage, and they can live a regular life afterwards.
We touched on all the organs. One left is testis.
Oh my God.
That is also a common cancer also that is found, testicular cancer. It's always missed. What can be done to diagnose it early?
Yeah, testicular cancer is unfortunately a big dreaded subject, but yeah, we need to explain like few stuff about it. Testicular cancer, usually the thing about it is unfortunately it comes in young men, okay, in a specific certain age group. So it can come also in like later on in life, but most commonly it comes in young men. So usually testicular cancer start as a small lump in the testicle, and it can sometimes like spread into the body. But what's known about testicular cancer, it's one of the cancers that really responds to treatment. Like most people have a very good response to treatment. It's rare to have a testicular cancer which is not responding to treatment. Now, as a general prevention, so usually we suggest for men to, as women do sometimes, are asked to check their breast. For men also, they should check their testicle by just like rolling it around their fingers and to check if they have like any specific lumps or issue. They should do it like once every like 2-3 months. Not necessarily they need not to worry really about it. It's not common, but whenever it's they have any
There is
doubts,
no
it's
harm.
better to check.
Yes.
There is no harm.
Yes.
It's better to check a professional opinion and to do so. As a urologist, whenever I have any doubts, even if I don't have doubts, whenever a patient comes to me with testicular like discomfort or anything, we have to do an ultrasound. So ultrasound is a modality, it's easy, it's not painful, and ultrasound can give us like a really big insight about what's happening. Lot of time it's we find like varicocele or other diseases which are easily treatable, but people do sometimes mistaken them for any kind of testicular tumor.
The difference between varicocele or let's say cyst, is it the same thing or it's different, completely different?
Actually, varicocele is enlarged veins around the testicle. The problem with varicocele is because they make the testicle a bit warmer, they can affect a bit fertility, they can affect a bit like they can cause pain, and sometimes if they are severe, they can shrink a bit the testicle, which make the people less fertile. So whenever we have varicocele, we try to treat them if they are high grade. If they are low grade, it's very common. We don't tend to over-treat things. While considering cysts are usually what we call in epididymis. Epididymis is like a very small part which is above the testicle. It's usually where sperms are stored. So these parts sometimes have a cyst. These cysts are completely benign. They don't necessitate any treatment unless they are enlarged and causing like discomfort in patient. But usually we do not touch them. Most of the time they are less than 1 centimeter and they are a very benign finding. And sometimes people mistaken them for testicular lump, but they are actually outside the testicle and they do not cause any issue and they cannot turn into anything malignant.
Epididymitis is a very common condition as well. It's treated usually with antibiotics. It has effect on the sperm quality. How long does that take? Like after treatment, let's say, the sperm quality can return back to its normal
Yes, actually, everything these are like factors which are reversible. So, epididymitis, as you said, is a common infection which happens, which causes pain in the testicle and the area around. And usually it can be treated either, it can be related either to a urine infection or to a sexually transmitted disease. But in both cases, it's treated with antibiotics. And the result usually are like in few months, everything will be back to normal. It will not affect long term unless it's not treated. If it's not treated, it can eventually it can lead to some sort of infertility. But usually, always patients do seek care for epididymitis because it's really painful.
Yes.
So we rarely have epididymitis which is like not checked or people will complain. Even male will complain about it, trust me.
Yeah. So it's actually the opposite of varicocele, because varicocele usually there is no symptom, and it's only when they are trying to have a baby when they diagnose to see fertility issues in both man and woman.
Yes, exactly. Now, varicocele have like two main things. It's either we find it whenever people are trying to conceive and we have difficulty, and then we find like on the sperm test that it is affected, that it's low in quality, or swimmers have bad motility. But usually also varicocele can cause like some sort of pain in the testicle whenever it's high grade. And the pain of varicocele is not persistent. It usually like comes shooting, and it's more like noted whenever we have like people who are standing for prolonged period, and testicle will like hang on for a long time, and it will cause like pain and discomfort.
Usually one side is more common than the other side. And this is a very common question. Why is it always one side more than the other?
Yes, it's definitely more common on left side because of the anatomy of the human being. Because on the left side, the renal vein is like different in anatomy, and the gonads are a bit different in anatomy and connection than from the right side. So that's why it's way more common on the left side.
So, doctor, we were talking about fertility, and touching down, we said varicocele is one factor that can cause fertility issues, epididymitis. Are there other factors that could cause fertility issues in men?
Yes, actually, a lot of factors can cause fertility issues in men. Now, one of the most common factors we see in our daily practice in our clinics that a lot of young men tend to take testosterone supplementation, which are given by their friends maybe, and sometimes in the gym. So the testosterone supplementation have a very bad effect on testicles, because people tend to receive like very high amounts of hormones, which usually tend to shut down the testicle. And whenever testicle is shut down, is usually like they do not form any more testosterone by themselves, and it will affect like fertility, sperm quality. And it's a big issue because most of the time it's reversible, but in many cases it can be like non-reversible in case it was for a very prolonged period.
This is a very common thing over here that we have, that those who go to gym, bodybuilders having steroids, not knowing that side effect is actually very
Yeah.
bad.
Yeah, this should be like more put into light by doctors and urologists specifically. They need to talk about it because really a lot of people are unaware of these stuff. Now, a lot of things related to fertility, like can be due to infection, can be due to varicocele, and sometimes it can be genetic. Whenever it's genetic, it's like more difficult to treat. Sometimes it's simple because some people have like a problem with what we call closed ducts. So they have like the sperm, they have everything, but they have like sometimes obstruction somewhere, which causes the sperm not to arrive to the outside with the semen fluid. And one of the issues we also face that some people have bad fertility due to smoking and using like substances which are not really good, and it can affect a lot the quality of their sperms.
That also affects the causes the erectile dysfunction. Smoking is one main factor, right?
Yes, definitely. Like smoking can affect eventually erectile dysfunction, but to be very fair, usually erectile dysfunction is a big topic, and it should not be like related to only one factor. So, and whenever whenever like a young guy smokes, although I do not like endorse it, but usually not just due to smoking. So smoking is a really big factor whenever one is like old, a little bit old, I mean, in age, and have like comorbidities as such as diabetes, hypertension, and other stuff, which can affect erection function.
Testicular torsion. That is also one factor for infertility, right?
Yes. Now, testicular torsion is an unfortunate event, which it's a testicle twist on its base. And the thing is, what happens, the blood supply to the testicle will become null. So, testicle will not have a blood supply. So, that's why it's one of the few emergencies in urology. We need to restore the blood supply usually within 8 hours. After 8 hours, probably we have a very high probability of the testicle to die. And people will become worried, how can I know if I have torsion? Usually torsion happens in young male during puberty most often, and they tend to have like very severe pain, and they will see that the testicle is in stuck position, which is different to the other testicle. So they will see it like it's upward and stuck and cannot move, and pain. So it's usually very like difficult to miss by any doctor. Whenever a patient comes to the ER, they try to do an ultrasound very quickly to document. Sometimes there is what we call a manual detorsion. So a doctor can like twist the testicle, untwist the testicle to make the blood supply comes back. But even if he's able to do that, we need to do a surgery to fix the testicle for it not to happen ever again. And whenever we go to do the surgery, we also fix the other testicle for to be safe, to be on the safe side.
Can we talk more on the erectile dysfunction part and
Yes.
how it has an effect on mental health, let's say, in men?
Yes, actually, erectile dysfunction is a big like issue, and it can touch like young and old people. All right, so it can affect any age. The problem with erectile dysfunction is depending on the age and depending on many stuff, we need to try to figure out what is the main issue that's causing it. Usually, it's always multifactorial. It's never like just one factor. But for example, for young males, there is definitely like almost 100% psychogenic or psychological part about it, because people tend to be shy, people tend to be not very comfortable with their body, and maybe considering like they have difficulty with a new partner and they need to impress and they need to show like good performance. Young people tend to have a problem. So it's important to discuss with the doctor to try to understand what is the main issue behind it. Sometimes by simply doing some blood test and checking with the doctor, a young male can be like reassured and can be eventually back to a normal sexual life. While whenever older people, we need to try to check for other risk factor which can affect anything related to the circulation, which eventually can also affect the heart. Because we know the penile artery and veins are like the smallest in the body. Whenever we have an issue with them, we also tend to have problem in other part of the body, especially I'm specifically saying the heart. So we need to check for risk factors, which are like hypertension, diabetes, cigarette smoking, and other stuff, which can affect like these small arteries. Now the treatment is depending on what is the risk factor. So we don't have like a specific button to press and then it's not magic. But once we try to understand with the patient what is his concern, what is he suffering, what is happening exactly, we try to do a tailored treatment for him. And treatment can be like sometimes very easy, just by like giving some pills, to more like extensive treatment for cases which are refractory to everything, which sometimes they use like a penile pump, and they have like kind of artificial erection, but which can still cause a pleasure for them and their partner.
Definitely. Doctor, could you just give us a take-home message for all the men, how to take care of themselves, how to live a healthy lifestyle and prevent these medical conditions to happen?
Yes, actually, so as man, I try to ask men to be like more open about their health issues, and as urologist, we should be like also more available and maybe give more insights and maybe more podcasts, more conferences, more awareness,
Mm-hmm.
and that men should feel at ease to discuss with any urologist or doctor eventually, because whenever things are discussed they can always a solution can be provided.
Mm-hmm.
But as a general rule, so of course, as any doctor will say, is that we need to try to keep a balanced healthy diet, we need to try to exercise, we need to try to drink water, and I guess we should try to be happy as much as possible, because the mindset of happiness and being like calm,
Mm-hmm.
it's very good for all the body.
Mm-hmm.
And whenever you're stressed and not feeling okay, it will be harder for you to live like happily and
Healthy life.
healthily.
Definitely, I agree with you on this point. Mindset is everything. As long as you keep the positive mindset and happiness is your priority, it has like an, let's say, immediate effect on your physical health in a way as well.
Yes, of course.
Yeah.
And whenever they face, like I will say for men, that whenever they face an issue, it's not a shame. We should discuss it. Everyone has his own problem. No
Mm-hmm.
one has no issues at all. So everyone has, sometimes it's small, sometimes it's bigger, but whenever you discuss it, we have a saying that says that whenever you share your anger, it will and like whatever disease, it might like decrease eventually, and whenever you share your happiness, it will increase.
Yes.
So you need to share, you need to discuss,
Mm-hmm.
and whenever you discuss and open up for subjects, we'll find solutions. We are here to help, and we are accessible, and we are happy and to help.
Yes, and doctors like are always seeing a lot of patients, and you might think your problem is really big, but then when they go to the doctor, they realize their problem is so small and
Yeah,
easily treated.
sometimes I even joke with my patient that I'm okay. You think your problem is big. I'm gonna
Yeah,
let you sit next to me, and here's
and
the
see,
next
yes,
coming 10 patients, and you will
yeah,
see.
the bigger
So,
problems that they have, but it's always important, like you said, share. And I like the wisdom that you shared. You share your problems, it decreases, and it's in fact very
yes,
true. Yes. Thank you so much, doctor, for sharing us your knowledge, your experience in this field. I'm pretty sure everyone learned a lot and can apply it and eventually try to prevent these medical conditions. Like, what's important here for us is to raise awareness, bring the topic out, and people, not only men should know, even women should know, so that they
yes.
can advise the men that they have, from children, husbands, fathers, and so on. For anyone who wants to meet Dr. Walid Obeid, you can find him in Emirates Specialty Hospital. Is
Yes,
there anywhere
exactly.
else that we can see
Yes, I
you?
also go to Motor City,
Hmm.
and yeah, I'm happy to help in anything and just discuss and make you feel more comfortable. And yeah,
Thank you so much.
pleasure.
Thank you, everyone, for watching us in this episode. If you like it, make sure to subscribe and put the thumbs up, as well as put on the notification button so that you get notified every time we release an episode. Thank you so much, and see you in the next episode. Bye bye.